Sometimes you forget about the team that's showing up for work, and they need to know what's happening that day because it's going to make their life a little bit more difficult or something they can get excited about.
Welcome to Season 7 of Bridge the Gap, a podcast dedicated to informing, educating, and influencing the future of housing and services for seniors. Powered by sponsors AccuShield, Align, Nick Map Vision, ProCare HR, Sage, Hamilton Captel, ServiceMaster, The Bridge Group Construction, and Solinity, and produced by Solinity Marketing.
Welcome to Bridge the Gap Podcast, the senior living podcast with Josh and Lucas. Another great episode on deck here at Leading Age National Conference here in Nashville. A good friend and a great guest on today, Nate Weyand from Querencia Barton Creek. Welcome to the show.
Hey, thanks for having me.
The famous Nate, if you are in Texas and probably do you have bodyguards here when you're walking the halls here? Just everybody wants you to be the CEO or the executive director of their CCRC.
I've been asked to be a bodyguard. Have you seen how tall I am?
I was about to say, Nate needs no bodyguard. People just move out of his way.
That's true. Yeah. That's true. Well, and your son's a tall guy too, right?
Yeah, he's a football player. He's 6'2", 250. He can knock me over.
First, tell our audience about Querencia. What is it like at Querencia, and how long have you been at the leadership there?
Querencia has been in existence since 2007. We opened, so coming up on 18 years. We're a part of LifeSpace Communities, based in Dallas, but Querencia is in Austin, Texas, on the west side of Austin, in Barton Creek. The hill country is what we call it. We're a full CCRC Type A life care, life plan community. We sit on about 38 acres, beautiful space inside of Barton Creek. And we've got about 310 residents that live on our campus, all the way through, independent living, all the way through memory care and skilled nursing. We're real fortunate to be there in Barton Creek. We couldn't recreate that community today. It couldn't possibly be redone. It's one of a kind in Central Texas.
Well, and I've had the privilege of being there and visiting there, and we actually cut a documentary together, which we could put, Sarah, our producer, can maybe even put a link to that so people can get a real sense of what it is, what it looks like there. It's stunning. We were actually talking before we hit record here. Staffing's a big challenge, finding good caregivers, good nurses, good people to come into your community and care for those residents. Talk about how you've been able to tackle that challenge.
I've been at Querencia since early 2012, so coming up on 13 years. It was a great place when I got there, but we've tried to bring a spirit of genuine caring, high integrity environment, and relational service, creating relationships with the people that we serve. I have a healthcare background as a skilled nursing administrator. Also spent about a decade in the private golf and country club environment. And taking those experiences, bringing them together, we're in the relationship business. We're in the people business. And so we try to really get to know the new residents that come in. Understand who they are, where they've come from, what they've accomplished in their life, how they can contribute to our campus, because they have a sense of purpose. They want to make our community better for having lived there. And so it's just about finding good people, genuine, caring people. On the staff, on the team member side, it starts with the leadership team, the group that I work with, my managers, directors, and developing them as good leaders, because I've often found in my travels in my career that it's those people that are kind of, we call them middle management, but it's really developing them as good leaders to develop the folks that work for them. And so we've got 250 people that work at Querencia, and I'd like to think that 250 are following that lead when it comes to being genuine with their residents. So far, it's worked well for us, and we've got a great team in place.
I'm sure while you guys probably have some advantages because of just where you are and how nice your place is, and we get to hear a lot about it. But what are some challenges that you're facing that you think are challenges that you can move the needle on as an operator? We often hear all the challenges that feel so out of reach that are really factors beyond our control, just demographically. but what are things that are tangible that you see opportunities to do better with staff recruitment, retention, culture, and things like that?
You know, you mentioned location, that it would actually be an advantage. It's actually one of our disadvantages because of where we sit in the zip code we're in. We tend to pull from a good distance away. I actually did a study a couple of years ago, and our average one-way trip for our team members is about 21 miles, which is a good distance in Austin, especially when you consider traffic. And so, you know, one of the things we're looking at is to potentially develop some type of housing support nearby, and looking at doing some roommate situations or bringing folks in to live a little bit closer. I think, you know, we've all heard about the Great Resignation and the post-COVID and kind of everybody dealing with inflation and some of this external pressures that we have. I think people show up because they care about the people they're around, and they care about making a difference. And so making sure that they participate in the success of the community. We've been very successful. Just last week in our all team member meeting, I shared with them the balanced scorecard. I showed them everything about Querencia and all the metrics, all the key statistics we track to make sure that they feel a part of that success and that they are contributing. And then just developing good leaders, really, truly, and I hate to be redundant, but it's just about making good, positive connections with the people that you work with, and making sure they feel those connections when they come to work.
Yeah, that makes a lot of sense. Well, and I think you touched on something that I am seeing in actually even one of our communities outside of Atlanta. It's a growing phenomenon. I think when you have communities that are as nice as what you guys have in the more affluent areas, perhaps, they're in these zip codes that are extremely difficult to find affordable living in, right? And the majority of our workforce need that type of housing. And so that is a growing phenomenon that I see for a lot of the senior living communities around the country. And how do you make it, and I think you touched on some of your ingredients, but how do you make it a destination for the team members, just like it is for the residents that seek out and want to retire in a place like that? But it sounds like connecting the dots between mission and actually showing them the fruits of their labor, which is probably a thing that I would say all of us could do a better job of.
We're fortunate to have a community that has a good reputation of quality care, quality outcomes, especially on the healthcare side and the nursing experience with those short-term rehab patients that come in. We're a Medicare provider. We provide rehab. And I've seen our brand and our reputation help attract to some extent, because folks want to be a part of something where they know there's quality that they can be proud of, and contribute in a positive way. And so, just that overall brand reputation. Now, how did we get there? I don't know that I can tell you in a short podcast. It's been a long journey of a lot of effort over a long period of time, sustaining that reputation.
Well, and the intentionality behind it sounds like that's been fundamental of developing and building leaders, because with a community that size and a lot of the operators in senior living, you're talking hundreds. Some of these providers have thousands of employees. How do you get that from the visionary, the leader at the top, or the corporate office, whoever it is, and carry that all the way down to a caregiver, housekeeper, a dining worker? Because ultimately, if you miss anything along the way and it doesn't translate to the caregiver, I guess it really doesn't matter. Because we can talk as much as we want to about it, but if nothing happens there, we've missed the mark. So you guys have also done some exciting projects. I've heard I get a little teaser occasionally to see what Lucas is doing online and showcasing the work that you all. Tell us about the recent renovation. I want to hear about that. You're updating already a beautiful campus, keeping it current.
Did you know that addressing hearing loss can have a positive impact on your overall health? Many studies over the years have explored comorbidities of hearing loss that can increase fall risk and cognitive decline. Hamilton Captel created an infographic on the 7 key comorbidities of hearing loss, available for download right now at hamiltoncaptel.com. hamiltoncaptel.com/7.
And while you're there, take a look around to learn about Hamilton Captel's different caption telephone solutions for home, office, and mobile, as well as the new internet-only option. For more information and eligibility requirements, please visit hamiltoncaptel.com.
Yeah, we a couple of years ago, we decided, it was probably 15th year, we decided, okay, it's time to refresh our independent living common space and one of our dining venues. And so worked with Lucas and the crew to come in and put that all together. And it was a great experience. We completely refreshed all of our IL commons, and now we're moving over actually today, we're over in assisted living on the first floor in our health center, and doing called a facelift, just a refresh, and working with 828 Design, and they're a great partner. And Lucas and what I appreciate about the Bridge Group and how they approach things is, their focus on senior living and working in occupied space. It's a unique experience. And so, his project manager, the guy I talk with daily, very attuned to the needs of the residents, making sure that we're not, displacing them longer than necessary, and really phasing things as we need to make sure that we come out with a good end product, but we're not miserable in the meantime. That everybody's life can continue on, and they continue to live and enjoy the community while it's getting updated. And so we're going to work, I think, through the end of this year, and then we'll keep going. We're going to do our third floor skilled nursing environment, and then we'll have a completely refreshed community in about year 18 or 19, and then maybe we'll start over at some point.
Yeah, well, I mean, to your point, it's not an easy task. It's a heavy lift when you have such a large campus. And here at the Leading Age National Conference, a lot of CCRCs are represented here at this event, and they're faced with a daunting challenge of even if it's popular, like Querencia has a waiting list, has always had a waiting list. They're very blessed and fortunate to just have that great of a community. Not everybody is in that situation, but even when you are very popular, you still have to think about CapEx projects and how are we going to maintain the standard for our residents that are, paying to live here. And so it can be kind of a daunting task to think, oh gosh, how disruptive is this going to be? All of the details, you really have to put a good team together. What would be your recommendation to the CCRC CEO or executive director that's listening to this podcast thinking, I know we got miles of corridors to update here. How are we going to do all that? What would be kind of your recommendation or your tips, Nate's renovation tips for CCRCs?
Couple lessons learned. There's always the resident side to
right,
this
and they're
equation,
involved.
right? So you've got to make sure that you're bringing them in to the fold early on in the process, because they have a sense of ownership that can be significant, and it can help you, it can work against you if not handled correctly. So the sooner you bring those key stakeholders in to have that conversation, to help them understand this is the scope, this is what we're looking to accomplish, so that there's not scope creep, that they're, hey, let's add this, let's add that. Let's make sure that there's a good level, a level set on expectation early on. And then just making sure you're working with a good design partner, an architect that spends the adequate amount of time investigating the site and looking at the work, making sure you're starting with a good plan.
And they have to go in front of the residents too. And be prepared,
and
right?
maintain and establish some credibility, and continue to work with them as you go through the project, for sure. And then again, just making sure that architect, you're always going to run into things when you open up the walls, you open up the ceiling, but just making sure you've got those good partners that can I like the phrase, be a linebacker, just read and react what's in front of you, and figure it out as you go through, because inevitably you're going to run into those situations. That's just my view from the ground level, trying to make it happen.
Yeah, no, those are good points.
Well, how much of that? So I heard a lot about the resident side, but I imagine for the team members, when they think, oh my gosh, massive renovation, how complex is my job about to become, to continue to to provide the care with maybe obstacles or people or inconveniences. You hear residents maybe not always, they're asking questions. So how much is the team a part of that? That's your team kind of working alongside all these other teams
Yeah,
together?
it's a great point, because sometimes you forget about the team that's showing up for work, and they need to know what's happening that day, because it's going to make their life a little bit more difficult, or something they can get excited about. So you gotta bring them into the fold, and that, their enthusiasm of having a new work environment, or maybe operationally making some logistical changes in how breakfast, lunch, and dinner is delivered, or different ways. That enthusiasm can build from them and spill over into the residents. They can positively affect the residents' view on what's about to happen.
Oh, I could see that. You're headed into Miss Jones' room, and she's like, already got what she wants to gripe about. And if the team member is equipped with information to understand how this is going to improve Miss Jones' life, that's a easy way to really combat that. So and to totally change the mood of the resident for the day.
And speaking about the conference, I mean, that goes to what the keynote was talking about yesterday, about having that happiness factor spill out into other folks.
Yeah, we heard a lot of positive feedback actually about the keynote at the dinners and different things that we were going. We actually missed that. We were in here doing some prep work for today, but what an awesome opportunity, for our listeners, Lucas. This is very valuable information, and I can't tell you how many times I've been guilty of this before too. You just get so gung-ho at moving the needle on a project. You've finally gotten clearance and you've gotten the capital lined up and you're ready to inject it. You just want to get going. And sometimes it's just real easy to jump straight to the start without what I heard you guys talking about is so much planning and intentionality and communication. And I think we as leaders oftentimes just want to push. Let's just get it started. Let's just get this done. But sometimes I think that's probably that works against us as leaders. Wouldn't you say?
Well, we're all action oriented. We want to get things accomplished, but doing it in a very deliberate way, and intentional is the right word, and bringing your stakeholders in, those residents, because ultimately you want them to feel good about it so that they can tell their friends, and all of a sudden you've got a friend referral or a family referral, and those are the most valuable new future residents you can have.
What are you most excited about for this upcoming year, 2025? What's going to be the focus and initiative for you guys? You got so much newness happening around there. What are you most focused on?
I mentioned earlier, we just kicked off a leadership development program for our supervisors, our charge nurses, and that's what drives me in the work that I do. You spend 13 years in community. There's not a whole lot of unknowns for me, and so my life's work hopefully is about just pouring into people and helping them be more successful. And that's really what inspires me, is to see the light bulbs go off for those managers that have been in that role for 2 to 3 years, but maybe haven't encountered all the leadership challenges that they are going to need to equip them to be future leaders. And so just seeing them evolve and climb is really satisfying. So that's a big initiative for us this coming year. And it'll be time really well spent.
And I'm hoping, just like, I got to hear, just because I'm buddies with Lucas, some of the projects that, and I know how excited he was, his teams to get involved in your community and then see the outcome of that we get to see on digital. That's really cool. Appreciate you sharing that with the industry. But I hope that we can have the same conversation to talk about the successes and the strategies for the team build, the nurturing, the building leaders, because I think that's the biggest piece and the hope that we have to care for this huge growing aging population that we have, and getting the most out of the leaders we have. We've got so many great people in our industry that are here because they want to be here. So shaping them and helping give them the tools and support they need is exciting.
I'm excited about too, just the level of technology that's coming to the business. I remember when I first got out of college and I met my wife. We got married. She went to be a CPA, and I went to be a nursing home administrator. And at times, I felt like I was stepping into a little bit of a time warp compared to what she was experiencing in her career path. And so here we are, 25 years later, and I'm seeing the technology at this trade show and all the AI and all the things that are coming that are going to make senior living that much better of a place to live, and all the efficiencies and all the things that are coming on the horizon. That's exciting for me too, to see some of those things implemented in our communities.
Absolutely. And seeing what works. There's, as you mentioned, there's so many solutions and options here, and it can be a little bit overwhelming with the regular grind of the day and the operations and the leadership training programs and the renovations. It's like, what do we pick first? What's going to move the needle? What's going to best support the team? What's going to best support the residents? But it is very, very exciting times for our industry for sure.
I think that's a whole nother podcast, is what technology to pick and how do you roll that out to 250 of your closest staff
Yeah.
and get them on board to use it. So maybe another podcast for another day. Nate, we're going to let you get back to the conference here and get back to all the different sessions and walking around and visiting these booths here amongst thousands of people here in Nashville. A lot of fun, great environment, and a great guest. Thank you, Nate, so much for spending time with us.
Thank you, Lucas. Enjoyed it.
And to our listeners that want to learn more, you can scroll down, hit the notes, hit that link, watch a renovation documentary at Querencia Barton Creek. Also, we'll connect with Nate and Lifespace and Querencia. And join us at btgvoice.com, download this content and so much more. Thanks for listening to another great episode of Bridge the Gap.
Thanks for listening to Bridge the Gap podcast with Josh and Lucas. Connect with the BTG Network team and use your voice to influence the industry by connecting with us at btgvoice.com.